Hi everyone, Dr. David Kulla here at Synergy Wellness in New York City. Today we have Liz here. We are treating her for sciatica, and she's been nice enough to allow us to show you how we treat a case of sciatica. So first we start the patient with heat, traction, or spinal decompression, and then we do a technique called Cox flexion distraction. This is the gold standard technique when we're dealing with disc herniations or sciatica. And sciatica is typically from a disc herniation. There are some cases where it doesn't come from a herniation or a disc bulge, but most cases are from stenosis, disc herniation, or a disc bulge, or spondylolisthesis, which can commonly cause sciatica. Now, her son's getting married, and I've been seeing your kids since they were babies, right?
Yep.
So, God, that makes me feel old. So they're all grown up now, and they're one of the boys is getting married, the oldest, right? And she's got sciatica right in time for the wedding. Of course, she's all stressed out, and it's when these things happen. So we're gonna get her fixed up before her trip down to Georgia for the wedding. If you guys want to crash the wedding, I'm gonna leave the address, the date, and time in the description. Just kidding. It's gonna be open bar too, so So what I like to do is, before I do flexion distraction, I like to get in here and loosen up quadratus lumborum, which is the muscle right on the side of the spine. And you can do this yourself by just coming in from the side of the spine right there. You feel that? And it's going to be tender, so you can do this for your partner. Don't do this to yourself, because you can't do it unless you're Gumby. And you can bend your arms in all different ways. So you can lay on your stomach and have somebody kind of find that tender spot, and you'll feel it like knot up like a ball. You feel that?
Yeah.
Yeah. So that's a little trigger point that she has in the QL, or the quadratus lumborum muscle. So here I'm just loosening up the muscles. I'm using trigger point therapy. You can go around in circles, clockwise, counterclockwise. I'm just going to loosen this soft tissue up, because by loosening this up, and I get in there and I do the flexion distraction, the Cox flexion distraction technique, we get so much more out of the treatment, because I'm loosening up all these muscles that are binding and pulling the vertebra together and compressing the discs and the nerve, the sciatic nerve for her. It's actually her opposite leg that's bothering her, right? Your right leg?
The right leg.
Yeah, so she actually has sciatica on the opposite leg. I'm on the left side. Why? Well, her muscles are really tight on the left and on the right. Also, she has scoliosis. So when I first met her, 20 years ago, we were dealing with not sciatica, just back pain from the scoliosis. And her generation, they never really, a lot of times they just didn't, you'll grow out of it, or maybe they brace you. Did you get a brace ever?
No, I took dance classes.
So her parents put her in dance classes to straighten her spine, which, don't ever do that. That never works. In fact, it could make it worse. Not saying don't put her in dance class. Do that. Put your kids in all sorts of classes. Get them active. But that's not going to straighten your spine up. But back in the day, they didn't have an answer for scoliosis. So now she's kind of paying the price a little bit of all these aches and pains and sciatica. And that's what happens if you have scoliosis and you don't address it or don't manage it properly. You're going to be in trouble. And we've given her different Schroth exercises to co-manage her scoliosis outside of the office at home. And she's been pretty good about them, right?
Trillion,
Okay.
I didn't do the exercises when I was a kid, so if you have scoliosis, do it when you're young, patch it when you're young, and do those exercises. And I'm working on it now. So.
You hear that? So now we're going to do the flexion distraction. Actually, I just loosened up her left side. Let me loosen up the right side. And there's a lot of different ways to do soft tissue to loosen this up, right? You can use the lacrosse ball. We've done videos on that where you put the lacrosse ball on your lower back and a slight knee bend. You can stretch, of course, but lacrosse ball gets in there really good. Any kind of trigger point therapy will help to loosen the soft tissue up. Now, the flexion distraction technique, none of you can do that because you need equipment, and the equipment's super expensive. This table alone is like $15,000 to $20,000, right? So you need the equipment, and just because you have the equipment doesn't mean you are certified in this technique. So we've had a lot of chiropractors or referrals from patients that have had this technique, and then when they come in and I do it, they say, oh, it wasn't done like this. That right away tells me that that doctor is not certified in the technique. So it's important that you have the equipment, but that you know how to use the equipment. Just having it doesn't mean anything. So she's real tight up here, a little bit higher where her scoliosis is. And you see I'm wiggling around. You feel that band right there, that tight band?
Yeah.
You need to get your lacrosse ball out
I got
in the
it.
next week,
I
okay?
got it. Right
And
there.
start from here down.
Okay.
Especially the left side lower and the upper side on the right, and start loosening that up. And we're going to get more out of our visits here, and we're going to get you jumping around and dancing at that wedding. You'll be a dancing machine at that wedding, okay?
Sure. I'm ready.
This is the Cox flexion distraction technique. So what I'm doing is my hand placement here is on her back, specifically contacting the spinous processes. So everything below my hand is getting decompressed, and it's a very gentle motion. You see here with my back hand, my right hand, all the way back here. But my hand placement on her spine is specific, and we're going to move it down. And you see how my hand is spread out, my fingers wide. There's a reason for that. We're bracing all the muscles that attach to the spine. So a wide grip or hand placement is important. And now we're starting to get down to her lumbar spine. Now the sciatic nerve comes from 5 branches. So 5 branches of nerves in the lower back come together and form the sciatic nerve. So we're just opening up the space in the back of the disc here, pumping nutrients into the discs. By doing this action, we're going to open up that pinched nerve, the sciatic nerve, and every time she goes and sits for a couple hours, it aggravates it. So I need to get her to the point where she can sit without thinking about it, especially because she's going to have to get on a plane ride to get to the wedding. And we need to get her to the point where she's not even thinking about her back, her sciatica, not even a thought. Now we're going to traction her out while I'm doing this motion. So I'm going to do the same motion, that flexion distraction, but we're going to traction this lower half out. So you'll see this table come out, okay? You might not be able to see it from where you guys on the camera. Trust me, it's stretching her out, tractioning her out, straight out while we do this technique. And one other therapy we haven't done, which we can do, cold laser therapy, because laser helps to reduce inflammation, inhibit nerves, reduce muscle spasms, and speed up the healing and repairing process. So we may use that here this week. We're not going to do it on this appointment because this is a video about sciatica and how we treat it. We don't treat all cases of sciatica with laser. The severe cases we do treat with laser. Some people just don't have the time and they need to heal up fast, and the laser just helps that healing process by about 40 to 50%. Okay, now, keeping the legs straight, you're going to raise one leg at a time. Go ahead. Good. The other one? Okay, good. They were both going up evenly there. So you're going to lay on this side. So now what we're going to do is ART on her glute, because the sciatic nerve comes from the spine. We just decompressed the nerve there. And now, just in case the piriformis muscle, touching my butt here, because that's where the piriformis muscle is, and that nerve can get trapped in there. Not as likely, but it can. So we're going to cover all our bases. So go ahead. You're going to swing this leg back and forward. Good. And back and forward. Back and forward. Good. You could do this at home. I've done some videos on this. This is called ART, Active Release Technique. Okay, and on your back. Luckily, I've only had sciatica once, called the piriformis stretch. Okay, so let's say the sciatica is down the right leg. For her, it's her right leg. She's going to bend her left knee, put the foot flat on the ground, take this ankle, place it up here. Yep. And then she's going to want to pull the bent knee, not the leg, the sciatica leg, but the other leg, the good leg, towards her. And you see how she's clasping her hands through her legs here and behind her knee? And that's what you want to do, and pull the knee towards you like that. Another way to do is, if you don't want to pull with your hands, you can lay down on the floor next to a wall. And here's pretend like my arm is the wall, and put your foot up on the wall and slide your butt more towards the wall, and that will push the knee up towards her head. Okay, and that's the piriformis stretch for those of you that suffer from sciatica.
Feels good.
Okay, cross your arms, tuck your chin, deep breath in, come on up. Okay, and hands up. In this test I check the hands, I'm checking the psoas muscle. It's one of a couple of ways that we can check the psoas muscle. Neck felt a little stiff there. Yeah, relax here. Okay, roll over to your side and come on up that way. And that, folks, is how we treat sciatica. Again, if she's not improving in a few days, we're gonna go right to cold laser therapy to speed up the process. Thanks for tubing in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.